So today we are going to see about some basic movements and their names. Flexion. When the angle between two segments decreases, it is called flexion. As from my previous video, we know that flexion is from sagittal plane and then transverse axis. Flexion is usually an anterior movement, occasionally posterior. Example, knee joint. If you flex your knee joint, you cannot flex it anteriorly. You can only flex it posteriorly. All flexion takes place in sagittal plane except for thumb. Flexion of thumb takes place in frontal plane. Okay, now we'll see about types of flexion. Dorsiflexion, moving top of the foot towards shin. Plantar flexion, moving sole of the foot downwards. Dorsiflexion and plantar flexion can only happen at ankle. Flexion of shoulder. Usually for other flexion, the angle decreases, but for flexion of shoulder, the angle increases up to 180. Lateral flexion, movement of trunk. The movement is lateral, so the plane is coronal or frontal plane. Extension, straightening the joint to its usual place. Usually it increases the joint angle. Mostly it takes place in posterior region. Abduction, movement of limb away from the midline. Adduction, movement of limb towards the body midline. Medial rotation, moving anteriorly and facing medially. Lateral rotation, moving anteriorly and facing laterally. In this picture, we can see the medial rotation of the shoulder joint. It is also called as horizontal flexion and lateral rotation also called as horizontal extension. Pronation of forearm. Medial rotation and hand faces posteriorly. Supination of forearm. Lateral rotation, hand faces anteriorly. Circumduction is combination sequence of flexion, extension, adduction and abduction. Protraction, moving forward. Retraction, moving backward. Inversion, moving in medial direction. Eversion, away, moving in opposite direction or lateral direction. Ipsilateral, same side of the body. Contralateral, opposite sides of the body.